This is Isabel, the Diagnosis Decision Support Tool. We've prepared this training video to help you get the most out of Isabel. Isabel is a diagnosis checklist system. Enter age, gender, and clinical features in order to get a list of possible diagnoses. You can also access knowledge from textbooks, journals, and external web resources. Start by entering age and gender. Enter the signs and symptoms. Be as specific as possible. Enter pertinent positive features. Do not use numbers. Instead, enter the medical terms for any abnormal labs or vital signs. Avoid using no. You can refine your checklist by adding or removing signs and symptoms. You can use abbreviations. You will also see some predictive text. Even if you don't see the word you're looking for in the drop-down, continue typing and Isabel will understand. Once done, click on Get Checklist. The top 10 most relevant diagnoses are displayed in a ranked order. This is based on the clinical data you previously entered and is compared to the Isabel database, which is updated every 2 to 4 weeks. There is also a likelihood indicator. It's the orange line to the left of the diagnosis. The darker the color, the more likely In order to see all of the diagnoses that Isabel has identified, click on Show All. This will allow you to see all trial diagnoses under the parent diagnoses. You can filter the red flag diagnoses. These don't miss diagnoses are those that are more serious and have a time-sensitive component. You can also filter diagnoses by system. For instance, if you feel this is a respiratory issue, click on RESP. If your patient recently traveled or is new to the country, you can modify their travel history. Once you rerun a checklist, you will see the diseases and parasites from that area of the world appear in the checklist, if relevant. Click on the Drugs tab if you believe that a medication, toxic agent, or poison is the cause of your patient's issues. With Isabel, you have access to resources. Access the knowledge page either by clicking on the diagnosis from the checklist or entering the diagnosis directly on the landing page, bypassing the need to create a checklist. In the knowledge page, you have access to various integrated resources, PubMed filters, annotated images, and an area that can be customized to contain the resources you have subscriptions to. All of this providing a context-sensitive one-stop shop to access the resources your institution has access to. Click on the resource on the left-hand side, and its contents will display on the right-hand side. Several actions are also available in Isabel, such as share, print, save, copy, synonyms, and feedback. Use the QR code to gain easy access to Isabel on your mobile device. Follow these instructions to save it to your home screen for future use. Examples of when to use Isabel. Cases with diagnostic dilemma. Multiple symptoms not fitting one diagnosis. When your patient is not responding to treatment. On patients in hospital without diagnosis for 2 or more days. Second visit to the ED with a plan to discharge home. ED or urgent care length of stay greater than 6 hours with a plan to discharge home. Here are a few tips when entering information. Be as specific as possible. Enter pertinent positive clinical features. Do not use numbers. Avoid using no. Include social factors. Include qualifiers. Enter travel history, if relevant. Check Drugs tab for side effects causing symptoms. Thank you for your time. If Isabel has helped you avoid a misdiagnosis, get to the right answer faster, or help you hone your diagnosis skills, then it's done its job. If you have any questions, please don't hesitate to contact us.